Ladies and gentlemen, let's welcome the graduates of the Merritt College Nursing Associate Degree Nursing Program. Good morning and welcome. This is the celebration of the 2018 graduating class. My name is Lynn Bratchett. I'll be your Master of Ceremonies this morning. I'm also the Assistant Program Director, and I'm also an instructor here at the nursing program. The faculty and myself would like to first and foremost, congratulate the students on their big day, their graduation day, their pinning day. Today has been the culmination of many years of preparation and sacrifice. The decision to go to nursing school didn't just happen overnight. There was a lot of preparation involved. Sleep, lack of. Personal time, lack of. Family time, oh, do I have family? Sorry, can't talk to you right now. Other personal endeavors have all been postponed. Care plans, papers, reading of several thousand pages of nursing text, weekly examinations and quizzes, giving numerous presentations. That is what their life has been for the last 2+ years. It has been said that nursing is both an art and a science. Florence Nightingale actually said that nursing is the finest of the fine arts. It is not merely a technique, but a process that incorporates the elements of the soul, the mind, and the imagination. Its very essence lies in the creative imagination, the sensitive spirit, and the intelligent understanding that provide in the very foundation of effective nursing care. Back in 1874, nobody in this room was here, okay? There was a system of training nurses that was in effect. Nurses were required to live in their place of work for 3 years. The first 6 months, they worked without pay and they were on probation. After that period, they were given a stipend, given room and board, and uniforms. By the way, they also had to be single. In the hospital's first annual report, the value of the trained nurse was documented. It was said that the vocation of nursing goes hand in hand with that of a physician, a surgeon, and they are absolutely indispensable one to the other. Incompetency on the part of the nurse renders useless the best efforts of the doctor in the most critical moments and has frequently resulted in the loss of life. They went on to say that all All the most brilliant achievements of modern surgery are dependent to a great extent upon careful and intelligent nursing. The skilled nurse, by minutely watching temperature, conditions of the skin, the pulse, the respirations, and the various functions of other organs, reporting those faithfully to the attending physician must increase the chances of recovery tenfold. Even back then, it was documented how important nursing is to life and human health. Today, these young men and women have chosen and have accomplished the attainment of graduating nursing school. Merritt College nurses are well known in the community. They're also well known across the country. Their reputation is outstanding in Bay Area hospitals. I've actually personally heard nurses who would prefer to have our students, Merritt College student nurses, over other nursing schools, including BSN programs. Our graduates are all over Southern California, the East Coast. They work in ERs, ICUs, labor and delivery units. They work in orthopedics, they work in health clinics. They work in case management services, correctional facilities, and a few of them actually even own their own healthcare facilities. The program has one of the highest NCLEX scores in the state. It's a difficult program, and today, you have earned the privilege of celebrating the completion of this program. So today we are here to honor you and you for them fulfilling and completing nursing school. Faculty would like to thank and congratulate the family and the friends and the ones who care about these young men and women. We want to thank you for your unconditional support during this multiple-year pursuit and for being and coming here today to help them celebrate this wonderful accomplishment. We celebrate you, their families, we celebrate you, their friends, and we celebrate them. So, let us get started with the rest of the celebration. I would first like to introduce our program director. She is a woman who is often seen behind the scenes and not seen very often, except of course when there's a problem, then we all go to her, myself included. But I'd like to introduce to you now Ms. Dawn Williams.
Good morning to everyone. Are you guys awake? All right. This is a celebratory day. I remember these students 2 years ago when I saw them in orientation, and I'm very happy to see them now. You look mature, you look not quite rested, but you do look happy, so that's good. I'm going to just introduce a few key players that have helped to make your family members who they have become. Our president of the college will be coming in shortly, but now seated with us presently is our vice president of instruction, Dr. Jeffrey Lamb. Dr. Lamb? And we have our Dean of Educational Success, Dr. Maria Spencer, and faculty, starting here on the corner, Dr. Megan Talbot. She is our lead fundamentals instructor, so she has them, she babies them, she makes them feel good as they go forward. Seated next to her is Miss Diana Barrios. She teaches drug dose calculation and perinatal nursing. Next to her is Dr. Mia Kelly. Dr. Kelly wears many hats in the college community, but for us, she teaches nutrition, pharmacology, and intermediate medical surgical nursing. Next to her is Ms. Donna Irvin. She is also a favorite of the students. She has them in the skills lab, and many times she teaches the clinical piece to the intermediate medical surgical course. Another faculty member is Ms. Iona Henderson. Ms. Henderson is lead for Nursing 5, which is Advanced Medical Surgical Nursing, and she is the advisor for this graduating class. You have already met Mr. Bratchett, but I'd like to tell you about two other people that are critical and somewhat behind the scenes to our program. One is Ms. Christine Lasher. She is not here. She is the program specialist. Sends out all of the, much of the email communication to the students. She isn't with us right now, but she is a critical piece. And also, the person that has been here the longest with our program as support staff whips us into shape. We certainly do what she says. All of the students know her. In fact, they meet her first, and many of the students who are not even in our program know her. She wields a big stick. She's got a big personality. Yeah, I'm talking about you, yeah. Miss Waduda Karim. The newest administrator that is supporting us here in our program is with us this morning. This is his first nursing pinning ceremony with Merritt. He is our newest dean of Division 3 of Allied Health. He is Dr. Rick Ramos. He is there by the door. Once again, thank you all for your support, and we're going to go forward because this is their day.
Okay, so we are actually going to move right along. The next person who's going to come up and speak with you is Dr. Megan Sari Talbot.
I have the honor to speak to you this morning about our nursing graduates, whom we are so proud of. Today we are celebrating a major milestone that you all have achieved. You nursing students all have the distinct honor of graduating from the 2017 ranked #1 nursing program in California. How about that? We've all been recognizing many folks today, and I would also like to take my turn to recognize some special folks. First, I'd like to acknowledge our Director of Nursing, Ms. Dawn Williams, and our Assistant Director of Nurses, Mr. Lynn Bratchett, for their support and encouragement of the faculty and students. We appreciate you. An acknowledgement to the entire nursing faculty for their wisdom, intelligence, and passion in teaching our students to be the best they can be. I too would like to recognize Ms. Waduda Karim and Ms. Chris Lasher for always being available to assist our students. Family and friends, you are so dear and special to our students. Your unwavering encouragement, sacrifices, and support of these students allowed them to be here today. They have all spoken of you lovingly and in appreciation on many, many occasions. Graduates, the pinning ceremony is a rite of passage that symbolizes your readiness in the world to care for humanity in a professional manner. Every time you wear the pin, you will remember the faculty, the staff, and your colleagues of the Merritt nursing program that were part of your journey and your professional life story. The pin reminds you that from now on, your mission is threefold: to care, to advocate, and to lead. You are now a care provider to your patients, an advocate for your clients, and a leader in any setting you might find yourself. In this ritual, you are becoming a part of the sisterhood and brotherhood of nurses. You have stepped onto a path that will take you to unknown places in your careers, in your global village, and most especially inside of yourselves. You will be called upon to serve the vulnerable, and through your service, to make a tiny part of the world that much better. You will wonder at times if you are making a difference, if your hard work really matters. You may never see the ultimate impact of your actions. Nevertheless, you will go about your days planting seeds wherever you go. And I believe in seeds. They have an inherent knowledge of how to put down strong roots and stretch up eager leaves and grow into who they are. Nursing school is not easy. It is a life-changing experience. Many of our students have returned to tell us that being in our program has helped them navigate through life and has taught them how to think outside the box. By your diligence and stamina throughout this program, you all have proven that you can endure whatever life presents you, whether it be the loss of a spouse, caring for an acutely or chronically ill child, dealing with a bathroom floor falling through to the basement, or even losing your hair. You have had to cope with many, many difficulties. It is hard to believe that less than 2 years ago, you eagerly assembled in room 309 for your first day of fundamental of nursing. The room was abuzz with emotions. There was excitement, curiosity, and eagerness to finally begin, and a fair bit of trepidation about this great and unknown before you. Each one of you arrived with a story, and one by one, you went around the room and shared just a little bit about who you are. And you even came back the next day. Remember the first day of clinical, afraid that a patient will ask you a question, and knowing that any minute your instructor will say, "Okay, let's see your patient care plan," that you spent all night preparing. I always wondered why I was walking down the hall and I saw white, and all of a sudden, when I got to the end of the hall, they had dispersed. They knew I was coming down the hall. Oh, here she comes. Oh dear. Over the course of the past 4 semesters, you got to share so much more than your stories. You have been there for each other through exciting firsts. I figured out how to take a blood pressure for the first time. I put in my first catheter today. I gave IV meds to a real patient. You have supported each other through hard times too, both within the course of your studies and in the rest of your lives, which did not cease to be challenging because you were in school. I personally have seen you rally around students that were not doing so well either outside or inside class. You have both made and received your fair share of stressed out text messages and phone calls, and somehow the people on the other end of the line who just months ago were strangers have become like family to you. As a cohort, you have done some pretty amazing work to arrive to this place today. You have forged through a rigorous academic and professional journey, one that can only be successfully completed through hard work, diligence, and determination. The nursing curriculum is very intense and elaborate, yet through thick and thin and throughout its joy and its challenges, you did it anyway. Bravo. One of the most challenging accomplishments you made is passing those wonderful nursing exams that we know you loved. Sometimes it seemed impossible to choose the correct answer because they all seemed correct. Here for our audience is a sample question. Question. Well, here's the question first. First things first. Which of the following patients would you assess first? A, the patient that states, "I'm having trouble breathing." B, the patient who is leaning forward and breathing with difficulty. C, the patient who cannot speak in complete sentences due to shortness of breath. D, the patient whose pulse oximetry is 88% and respiratory rate is 32. For our audiences, those are not good numbers. So what's the right answer? All of the above, but this time select all that apply was not there. So they really had to use their smarts, and you did, and you should be so proud of yourselves. You're experts on taking exams. But they're all correct. The point was, it's like they had to choose one. They had to dig through their knowledge base. There's one that's the most correct. That's the challenge. By graduating from Merritt College Nursing Program, you are in a position to significantly make a difference in the lives of your patients. Your instructors have challenged you to think critically, be acutely aware of your patient changes, and to be champions of patient advocacy. We've encouraged you and even demanded that you be the best nurse that you can be and to protect the health, safety, and right of all patients. That is mandated by the Nursing Code of Ethics. You are entering a field that has for the last 16 years been consistently rated as the #1 most trusted profession by the public according to a Gallup poll. The trust that you establish between you and your patients is sacred, and this makes you accountable and responsible to them. When I ask people what they think about when they hear the word nurse, I get responses like compassionate, hardworking, merciful, attentive, intelligent, thoughtful, and dedication, to name a few. We also know that nurses are knowledge brokers, confidants, liaisons, patient advocates, problem solvers, and change agents. But the word I want to focus on this morning is dedication. Dedication is best described not in words, but in the actions of a nurse. Dedication is a nursing student walking down the hall to a pediatric patient room every hour to collect a diaper, inspect, weigh, and chart the less than pleasant findings. Dedication is a nursing student who learns to hide the repulsed look their face so desperately wants to make as they change dressing or empty a drain. Dedication is a nurse who learns to just be silent and be in the moment with the patient who just needs someone to cry with. Most of all, dedication is a nurse who takes her or his profession seriously with patients' precious lives in their hands, double checks their work, and delivers safe, professional, and holistic care. This nurse views nursing not as a job or a task, but as a service to others to ensure the patient has the best quality of life possible. From the first day of Nursing 1, you have shown your passion for nursing. When asked why you wanted to become a nurse, you answered, "Because I want to help others and teach them to care for themselves." Look how far you've come. From not knowing how to apply a pulse oximetry on a patient's finger to telling your primary nurse, "This patient with ascites has low blood pressure because his albumin level is low." Nurse talk. From barely being able to speak to a patient to confidently caring for a 4-patient assignment. I have had the privilege of observing you at the beginning of the program in fundamentals and at the end in advanced medical surgical. It is so gratifying to see you and how you've developed into confident caregivers. You have the opportunity to be leaders in the healthcare system, and I hope that you will endeavor to be the trailblazers that we know you can be. Now that you are scaling one big hurdle by graduating, you will be looking forward to taking your state board exam and proceed to find your first nursing position. Even if your first nursing job is not the one you really wanted, you can make it interesting and challenging by going above and beyond the job description. Make it an opportunity to learn all that you can so that you can transfer that new knowledge going forward. With the changing tides of healthcare in our nation, the public will look to us in the future to be prepared to lead the way. We must ask ourselves, what can we do to contribute to nursing, and in what way can we become effective change agents? Maybe you will invent something that will make the nurse's job more efficient, or perhaps something to make patient care safer. Maybe you will go on to earn your bachelor's, master's, or doctoral degree and participate in making major changes in the healthcare system. Or maybe you will simply come to work every day prepared to give your attention to excellent patient care. Whatever direction you decide to take, remember to keep your moral compass pointed in the direction of compassion, empathy, and caring. Use your voice to advocate for your patients. Nurses have power in their voices, and when we execute that power, we can change the course of somebody's life. So as you begin your journey into professional practice, I want you to remember that you are blessed and that you have a voice. It's not enough to have a voice, but you need to exercise it. Get involved. Once you have acquired a new nurse graduate position and have made it through orientation and those precious first 6 months, I want you to kick it up a notch. Get involved. How do we get involved? Read the literature, ask questions, challenge the status quo, join a professional nursing organization, sit on a committee that is action-oriented, go back to school, or mentor a new graduate. Only by getting involved and having a voice can the nursing profession truly be the leaders and patient advocates that the public expects us to be. As Gandhi said, be the change you want to see. Congratulations.
Thank you, Dr. Talbot. That was beautifully said. With great knowledge comes great responsibility, and that responsibility starts with you. Next, I would like to introduce the president of our college, Dr. Elaine Byrnes.
Good morning. I won't talk a long time because you got to hear me last night, and I think I got an opportunity to shake everybody's hand last night. But first, let me welcome your family, friends, to Merritt College and to this important pinning. This is one of our major accomplishments. The nursing program is our Starship program at Merritt College. So we're always very happy to see the classes come through and ready to get out there and do their thing. Mostly because, not only because they've been trained so well by our faculty, but because one of the commitments Merritt has is commitment to community. Merritt College puts the community in community college, and these folks are paying it forward by belonging to a profession that works with the community. So we're very happy and proud of what you've accomplished, because it's not an easy task. We have some taskmasters in that nursing program, and they make sure that our students know what they're doing. But also because you're giving back, and that's so very important, and you heard me talk about that last night. So welcome to all of you. We are so glad, and I will help them thank you all for supporting them through this, because it wasn't an easy process at all. And sometimes you probably didn't see them very much, or they were a little bit grouchy because they were studying and trying to figure out things. And so we appreciate what you've done to support them and see them to this point. So thank you so much for that. And so with that, again, I won't take long. I just want to say congratulations. Again, Merritt College is so very proud of you, and I know your faculty is as well. And we look forward to you doing great things in the community, making us proud. And don't forget to encourage more folks to come to Merritt so they can do what you're now doing. Thank you, and congratulations. Good luck. Best wishes.
Thank you, Dr. Byrnes. So up until this point, you've heard from mostly faculty, administrators, okay? And these guys have been listening to us for the last 2 years. They're sick of us. So what we're going to do is the class speaker today is a very talented young man. He's got good leadership qualities. He's led this class, I think, to a place where they're happy with the end result, which is today, the culmination of today. So without further ado, let me introduce Mr. Roddy Van Ooy.
I didn't tell my family that I was going to give a speech today, so surprise. And today's my father's birthday, so happy birthday. Love you. First and foremost, I'd like to thank the group for selecting me as Merritt College 2018 nursing class president. Any one of my fellow classmates is and will be a leader in the field of nursing, and could be standing right where I am today. I would like to share my story and reflect on some of the lessons that I've learned throughout my time here at Merritt. There is a saying that it's all about the journey and not the destination. I'm not saying that both of those aren't important, but what I've learned at Merritt is that what can truly be the difference maker is about how you got started. I remember it like yesterday. I was 21 years old. My daughter was 18 months. I was sitting in a pediatrics office, staring at her beautiful big brown eyes and gorgeous smile. What a happy child she was. After a short assessment, the doctor had said something that would change my life forever. He said that I believe your daughter's autistic. I remember the look on my wife's face, completely distraught and devastated. Tears began to well up in her eyes, and I did what I thought anybody would do. I lied to her. I told her that everything was going to be okay. But of course, I had no clue what was going to come in the near future. But about 6 months later, my daughter had begun to regress, and every day was a struggle for her to be able to function normally. Being a parent and seeing your child suffer every day and fight to be comfortable in her own skin is something I hope none of you ever have to go through. However, their struggle was the driving force that kept me going day in and day out. So many times I wanted to give up and quit, but with every page I read and every question I answered, they were there telling me that I can do so much more. They taught me that no matter how hard things get, they won't quit, so neither can I. I realized that their pain was the driving force. And during the first week in skills, I finally made the connection. The sixth vital sign, pain. It's what we all can connect with. We all can understand pain, in whatever form it comes. And it's the main reason that you're in the hospital in the first place. This is what nursing is all about, making you feel better whichever way you can. The second lesson that I learned is to never leave your patient when something is going wrong. I certainly mean this in the most literal sense. When I spot VFib on the monitor or see a patient collapse, I'm going to physically stay with my patient. But I think this can also be applied to other aspects of our lives. Nurses don't run away. Nurses see a challenge, respond, bring it on. This certainly happened 2 years ago when we were all bright-eyed and bushy-tailed, eager to begin the Merritt nursing program. Naive as we may have been then, here we sit on the other side, having conquered the first challenge in our nursing careers. The next huge thing that I've learned in Merritt is to always call for help when I'm in over my head. None of us have gotten to this point alone, and I'd like to take a moment to thank the people both present and not present who have brought us to this point. Parents, children, siblings, spouses, significant others, grandparents, extended family, friends, coworkers, and any other loved ones not otherwise mentioned, you've loved us through our most selfish 2 years. I speak for everyone when we say we cannot be more thankful for your guidance and support. We may not have had the time to articulate it, and words will never truly do you justice, but we never would have gotten to this point alone. To the staff and faculty members, again, we would be nowhere without your wisdom and guidance. Some were the warm, fuzzy type that would hug us and send us encouraging words on a rough day. Mostly you gave us the tough love that we needed to make us the best nurses we could be. Regardless of approach, you all worked for us and want us to see us succeed. We are all better nurses for being in your presence, and for that, we are endlessly thankful. Finally, It's time that we thank each other. When spending so much time with a group of highly motivated, compassionate, intelligent, and genuine people, it's tough not to love your peers. I met some of the most inspiring people sitting right next to me in the classroom, from the long library study sessions, to exchange study guides, to flashcard quizzes during downtime and clinicals. I know that I could not have survived this program without the support of a wonderful group. I am truly honored to have been in the presence of all of you throughout the last 2 years, so for that, I thank you. Now that I'm done with my savvy thank you detour, let's get back to the lessons I've learned throughout my time as a Merritt nursing student. It's really important to know that sometimes a Warriors game is more important than class, just once in a while. The biggest compliment I've ever received as a nursing student was during a course evaluation at the end of one of my clinical rotations. Amongst the standard feedback, my professor said to me, "Nursing needs you." At the time, this struck me as odd. I always thought of nursing as a profession that was fitting the needs of my lifestyle, not vice versa. We're all entering the profession for different reasons. I ask you all to shift your perspective and consider this. As much as we want to be nurses for whatever reason, the profession needs us in return. Nursing needs new eyes, caring souls, different perspectives, and critically thinking minds. I've met you all, and I know what you have to offer. I'm confident that this room contains a new bunch of registered nurses that will push boundaries, establish innovative practices, and invigorate the ever-changing profession. During our orientation, I was sitting amongst many of you, having no clue what this program had in store for us. When asked to describe Merritt College, both staff and former students used the word challenging. I'd like to offer a few different adjectives to you now. Mentally, physically, and emotionally exhausting. You would be hard-pressed to find any student in this room who could honestly claim they had a normal, healthy sleep cycle throughout the past 2 years. I can safely diagnose the entire class with fatigue, anxiety, and stress overload related to sleep pattern disturbance, impaired social interaction, and imbalanced nutrition as evidenced by the bags still remaining under our eyes. But at the same time, I would describe Merritt as holistically invigorating. There's nothing quite like a hug from a patient or a pat on the back from an instructor or classmate to help boost one's confidence. Just being here, having finished Merritt, the hardest nursing program in the state of California, I feel that I can do anything. One last thing I'd like to say is the velocity in which we live our lives is less important than the acceleration. No matter how hard, difficult, or challenging things can be, no matter how much pain you're experiencing or how low things get, there's always a light at the end of the tunnel. If you look closely, it might just be one of us holding our lantern. Thank you.
Next, we have another student speaker who is someone who, much like Roddy, all of them, when they first came in the door, they were like deer with headlights they'd never seen before. They were scared to death. Today, you look at them, they are mature, professional individuals. The next speaker, Ms. Tisha Dury.
So I'm just going to be honest. My speech originally was longer, but I tried to be really cute last night at the graduation, and my shoes killed me. So I said I was going to shorten it a little bit, but I still got the core things in here, okay? So good morning. My name is Tisha Dury, and I'm the Vice President of the graduating class of 2018. And this morning I want to take a moment to share some of my thoughts with you about this class. I've often heard people say that it takes a special kind of person to be a nurse. It wasn't until I attended this program with these people sitting right here that I realized how true those words are. I've always wanted to be a nurse, but I didn't decide to pursue it until 5 years ago when my father died. That loss put a fire in me to pursue my dreams. This journey wasn't easy. Being a single mother of 2 kids, working and trying to put myself through school pushed me to my limit. There was a moment during my intermediate med-surg rotation where I was really contemplating quitting. I was going to quit. And Roddy and Marn said to me, "No, you're not going to quit." In fact, Marn said, "Girl, you are not quitting." I started to think about my classmates and what they were going through, driving 2 hours each way just to get to school. I mean, we have one student coming all the way from Modesto to get here. Another classmate limping her way through clinicals on a torn ACL. Parents who take care of special needs children at home that require a lot of patience, attention, and love, yet they still find it in their hearts to show up every day to learn how to care for somebody that they've never met before. We have classmates here who have lost their spouse and still found a way to single parent 2 children. People who were told, you're too young, you're too old, you know, you've passed that point in your life, why try and do something at this stage, you know, all kinds of excuses. But they still soldiered on, and they're here. These people make me proud to be here. They're more than special. Some of them very special. We've looked to one another for comfort and guidance, and because of the promises that we've made to our families and the commitment we've made to ourselves, we became friends, and those friends became family. We are the class to leave behind a legacy of change and new traditions, like starting a registered nursing club for the school, an alumni group, and we opened up new avenues for fundraising. There were those of us, some of us that didn't make it with this class, and we want to say that we carry you with us in our hearts on this day, and we look forward to your graduation. And to my children, Omar and Amir, thank you. Thank you for not killing each other. And thank you for understanding when I couldn't always be there for you. It's because I was trying to secure a better future for our family. I love you very much. To my classmates, it's been an honor to go through this with you, and I am humbled and in awe. Thank you.
Next, we had mentioned earlier that we'd have a couple of visitors come in mid-session. So I look around the room and I notice that our chancellor is here. So I would like to introduce to you the chancellor of Merritt College, Dr. Laguerre.
Thank you. I love the comment of the kids not killing each other. That's a great blessing. I want to say congratulations to all of you, and want to thank the supporters of the students. I have had a wife and a daughter who have gone through nursing school, and I know that as supporters, we have no choice but to learn as they learn, because sometimes they have to try the new knowledge on us, even if we're not interested. And someone like me who has a heart whereby I pass out easily when I hear about pain and the like, and they want me to know everything that they've experienced. So I know where you've been, but it will be very glorious as they continue their careers and their education. And to you, those of you who were at commencement last night, my word still remains the same, in that you had dreamt of a future. It didn't remain just a dream. You made it become reality. And there are many other futures awaiting you. Future of a job, which your supporters will be very happy that you have. But also the future of further education, because for as long as you live, you have to continue to learn, because this is the way that you'll be the best at your profession. And none of us dreams of being the worst in our profession. We want to be the best, and that's what we expect from you. congratulations, and move on and create another beautiful future for you and your family. Thank you.
So, the next section we are going to go with here is the presentation of awards. Dr. Kelly.
Good morning. Congratulations to all of our stellar graduates. Each year, we present 2 awards. The faculty votes for the students that best fulfill the characteristics that are outlined in the criteria for the awards. And these awards do come with a monetary gift, which is good. And it's always a difficult decision because our graduates are so magnificent. The first award is the Marion Patrika Tadlock Award. This is an annual district award that's given to a graduating nursing student. Marion Tadlock was a registered nurse, educator, wife, mother, and a responsible and active citizen in her community. The legacy she leaves is a world better for her professional competence, her responsibility to duty, her strong beliefs and ethical principles, and the warmth and vitality she shared with all she touched. The student chosen for this award demonstrates these qualities of nurturing, caring, clinical excellence, professional competence, and high ethical standards. I'm happy to present this award to Sarah Murphy. The second award is the Kaiser Clinical Excellence Award. An anonymous donor established this award and partnered with Kaiser Permanente in 1997. The graduating student chosen for this award exhibits the following characteristics: clinical excellence, excellent communication skills, an ability to work well with others, a sense of professionalism, and a dedication to nursing. The student chosen for this award is William Lawrence. Congratulations.
Thank you, Ms. Kelly, and congratulations. Okay, this is why we have nursing pinnings. At this moment, we're now going to take a moment to recognize each and every one of our new nurses.
Okay. Artem Zosan. Arya Wahaj. Marn Seychow. Jacqueline Richards. Terry Wynn. Naomi Muthi. Audrey Harper. Megan Elms. Gloria Curling. Nice. Celeste Barrick. Carolina Alvarez. Alicia Mahedeo. Joe Lawrence. Sarah Murphy. Kara Smith. Tisha Duray.
That's right.
Roddy Vanoy.
Now that we have the pins, it's now time for the nursing pledge. Graduates, if you will stand, and Ms. Irvin will lead us in the pledge.
At this moment, we'd like to take time to address the fact that this profession is very highly revered and is taken so seriously that we have our own pledge. And we'd like for the graduating class to actually repeat these words after me as a way of solidifying the fact that they plan to uphold this pledge. And please repeat in short sentences after me. I solemnly pledge in the presence of this assembly as a professional nurse. I solemnly pledge in the presence of this assembly as a professional nurse and patient advocate. To devote myself to those committed to my care. I shall maintain and promote the health and dignity of all patients. And shall respond to the patient as a unique individual. And as a whole person. I shall encourage patients, their families, and their community health team. To be involved in the planning and implementation of care. I shall hold in confidence all personal matters to my knowledge. With the understanding of my values and beliefs. I respect the personal values and beliefs of others. I shall honor and continue to elevate the standards. Of nursing. And shall endeavor to practice this profession. In great sincerity according to its codes and its humanity. Congratulations and thank you.